You are listening to Personalization Outbreak, a podcast about the collapse of traditional corporate standards in today's more personalized world. I'm Llopis. I'm a leadership strategist, author, contributor to Forbes, and founder of the Leadership in the Age of Personalization movement. On this show, I'm interviewing executives across multiple sectors to find out how the balance between standardization and personalization can exist. Welcome back to another episode of Personalization Outbreak Podcast, where today we will explore the intersections of technology, humanity, and innovation. Now, our guest today is Azeez Narain. She's a Senior Vice President and Chief Digital Officer at Hoag Hospital in Newport Beach, California. Now, before I continue talking about Kathy, the professional, I want to take a moment to talk about Kathy, the individual. Put her on your watch list. This is someone I've had the opportunity to get to know now for about I think it's actually almost a year when I first met her. And I just want you to just stay in touch with and listen carefully to how she explains things, how honest she is, and most important, just how real she is about the current dynamics in healthcare. But be that as it may, she's extraordinarily committed to this industry as being someone that came from outside of it. So I just wanted to pause there because oftentimes we have these interviews and we think about the big titles, and I just want you to really pay attention to who she is as an individual. And I say that because, she is the Senior Vice President and Chief Digital Officer at Hoag Hospital in Newport Beach, California, but she also leads the development of the institution's transformation strategy. So there's a big weight on her shoulder right now to not just maintain Hoag's position as an innovator in delivering the highest quality of care and exceptional patient experience, but to do what's right. And this is what I respect most about the way Kathy thinks and who she is. And again, her deep expertise will address many critical topics today, like reducing the administrative burden of healthcare workers, creating genuine trust through personalized marketing, and addressing the systemic issue of workforce burnout through creative, tech-driven solutions, and much, much more. So before we get started, please click the like button below, share it with your colleagues, and subscribe to our YouTube channel and social media at Llopis. Let's now welcome Kathy. Kathy, I can't thank you enough for taking the time. I know I went veered off a little bit on your intro, but we're here to keep it real because I think that this is what people want today. And I really appreciate who you are and what you bring. So thanks.
Thank you, Glenn. I'm glad to be back chatting with you about all the fun topics we do all the time, mostly tech, patient, consumer, life. And so thanks for having me. Looking forward to talking a bit about the topics.
Well, thank you. It's interesting, right? You said life, and as you think about today's healthcare worker, I think it's fair to say that as much as they think about their job, they think about their own obsolescence sometimes. There's just so much going on at a pace that's so fast that, as I've heard many healthcare executives mention to me, it's like, am I really catching up or am I taking two steps back? I'm not too sure, but I know I'm pretty active every day. So let's get to the heart of the matter. Because there's a lot here to talk about. And so you know that many patients today, unfortunately, feel lost in today's fast-paced, industrialized healthcare system. How can data analytics, AI, digital platforms begin to empower providers to see patients as individuals rather than just numbers or codes in a system?
Yeah, I think it's interesting because when I took this role back, it's 4.5-ish years now, right? Time flies when you're having fun,
Wow.
they say. Yeah, I know. Um, I always stepped into this because I saw healthcare as very different than what I was doing in past from an industry perspective. What I mean by that, it's a human-centric business. It's not a technology business. And I was simply, even as recent as of yesterday, I was chatting with someone. I was saying, look, you have all of these companies, big major ones that people talk about all the time, right? When you think about Apple, they're a product company. They know product is in their vein and their DNA is product thinking, right? Design, experience thinking. When I think about Amex, which is my past and a healthy, past, I must would say they're a customer service and experience business, right? And when you think about healthcare is a human-centric business. And I don't just say it as a customer experience business, because it's not about it just experience.
Mhm.
There's a lot of emotion to unpack in healthcare.
Mhm.
And so, you know, I will say to the credit of our providers, and probably this rings true for all of them, at the when they go through this process of going through the med school, getting out of there, starting to work, they come in with an ethos. They want to help people. I hear that through and through. All the doctors we talk to, whether it be primary care specialists, the underbelly at the core, they want to help people, right? And for me, technology can be leveraged in a way to make them spend the time with people in a way that you feel like to me, the physician being the product is
Mhm.
the one most interested in everything you have to say. And the
Mhm.
more and more rigor that's come into the ecosystem of healthcare in terms of, hey, make sure all the coding is right, make sure all the documentation is right, make sure that, the system is up to date, make sure you check all the boxes because of regulatory reasons. The doctor's role, which is about spending time with the patient, becomes more and more frayed. So where I see it from a getting to the individual again is I'm looking at it through the lens of what are the tools, the platforms, the ways that we put them in play for the provider so
Mhm.
that majority of what their time is spent on is that patient, is that human connection, is dealing with the emotions around the healthcare narrative, right? And if you, so, you'll hear everyone talk about all the many tools happening right now. AI is the big frontier at this moment. And from, scribing and ambient scribing and AI driven documentation and relieving the physician of things that were starting to happen to them, right? In terms of now, this is your responsibility too. It's not just Kathy in the room. It's, it's Epic. It's the tablet, the computer screen is also in the room, and that's just as important as the patient. My thought is that technology really now needs to be leveraged to remove it almost from the provider having to worry about it, and it can do some of the heavy lift for the patient pieces and for the operational pieces that give you back that time with the provider, and for the provider time back with the patient. So that's, just kind of at the highest level, how I'm thinking
Yeah.
about it and where I think it plays a role.
So what do you, again, just on average, what would you think is the amount of time that, and they don't have to be from Hoag, just in general, from the research you've done, how much time do you think a physician spends with the patient today, and what are you foreseeing in the future with the integration of technology, how that number might change?
I'm going to answer this in, in the Kathy style, right? So there's all these industry numbers, and I say doesn't matter in some ways. Like I truly don't know if it matters. You know what
Hmm.
matters? You're the patient. Let's say you were the patient. I was the doctor in this position.
Hmm.
What
Hmm.
matters to you is when you've come to me, you felt that one, I'm listening, and two, you walk out with valuable, either clinical or expertise, that you now had this interaction with me that made you better or fixed your problem, or at least gave you a roadmap into fixing that problem. When you read patient stories, you never hear them talk about the technology. That they don't rate patient satisfaction on the technology. They rate on how long was it to get to you, how you know, the care felt like it wasn't in the room with me. The doctor never looked at me. He or she spent most of their time looking at the screen and just asking me questions. Like I wanted to show them something, but they never really paid attention to
Hmm.
that. Patient experience and satisfaction really highlights those thematically. I think nationwide and industry wide, you hear that in healthcare. And so from your question of how long is the average, I think for everyone, if you and I had a 10-minute conversation and I felt that you connected with me, you heard my problem, and you gave me some valuable next things to go get done, I wouldn't even think about the 10 minutes, right? Because I could have spent 40 minutes with you and walked out and been like, oh my gosh, that was the worst 40 minutes of my life, you know? And so I think the sense of time and the pressure of like, the doctor saw you for this long or that long is the wrong bar to measure it at. I think
See,
the,
Kat, go
sorry,
ahead, go ahead, go ahead. I'm
no,
sorry.
no,
Go
you
ahead, go ahead.
finish. Now, I was just going to say, I think the measurement needs to be, did we create that moment of you came to the provider gave you value, the provider felt like they gave you value, and you left much better than when you walked in my door. That I don't know how to measure that, but that to me could be 5 minutes. It could be 20 minutes, depending on what the complexity and the need looks like. And so I come at this from different because I know the industry, you know, like, hey, 15 minutes, 20 minutes, 40 minutes. And I think there's things that you could bang out in 2 minutes. And me being someone like sometimes I just want to ask a question and get the answer and I want to move on. And I'd rate you 5 stars for that, right? And then there's other things that I might need more time on.
See, this is why I asked you the question and why I introduced you the way I did, because I actually thought that you might go in that direction. Why? Because
Spending
when
too
you were,
much time together.
no, no, but that's a good thing, right? Because I don't need that much time to know the experience that I can get from you. See the point?
Hmm.
But then this becomes, let me take you back to the first question.
Yeah.
How is technology going to solve for that? Because when you explained it, it was about giving the physician more time with the patient.
Yeah.
With the way you've just described this, which by the way, again, we're all different, but I'm sold on what you just said.
Yeah.
Because you know how many times I've been not, I mean, fortunately, I'm a healthy guy, but having dealt with my mother and her recovery from a stroke, very few of the physicians take the time with her, let alone look at her.
Yeah.
And
You
so
just
when
said
you talk,
something right there. Like
go,
very
go.
few looked at her. When I define time, I break the mold of what the definition is in my head. Time is not about the number of minutes. Time is
Yes.
what you've defined it as. Like I could spend 5 minutes with you and we can go deep on a topic in that 5 minutes, have a robust conversation. And I walk away feeling like, oh, I just spent some really good time. That quality of that 5 minutes was so good, right? Versus there's people you meet and you have that hour-long meeting and you walk out the meeting, you're like, what was that hour of my life, right? So I'm not even, and maybe I should have explained that a little bit upfront. When I talk about time, I'm saying, hey, you're sitting in that room with the physician, or you're sitting at home, right? And you're doing a virtual visit, and the doctor and you feel like you're the most important thing in that moment, and the doctor is really focused on hearing what you have to say and responding to that. And that is a definition of time in more of a quality aspect of the interaction rather than just the minutes or the hours that was spent in a session. And for me, virtual has this bad rap from a platform sometimes because it could feel very transactional, right? It could feel very like, okay, in and out. But it has a role to play because let's say I have this amazing provider that and let's, call it in the primary care space. And
Mhm.
there are moments where I'm going to need to come in and there's going to be things that we might have to go deep on. But then there's moments that I want a response because rather than Google it, right? And I've been reading all about, Google and AI and answering medical questions. And I know things like that are going to pop up. But rather than me Googling it, if I have a trusted clinician, in today's world, people make it feel like, well, that needs to now be a visit, and that now needs to be a different, a slot that you have to fit into. But why can't it just be as easy as what you just said? The entire infrastructure is more about, you know, how are we connecting everyone in a way that's not about B2B or B2C or this
Mm.
channel or this structure is meant for this. But what if you broke that all down? Right. And so I think that the time is coming, and especially with AI, the time is coming where all these silos and these rigid line draws are going to need to be redefined. And even a word such as time, when what it actually depicts in healthcare, will need to be rethought about.
I want to be mindful of time, but I'm going to just volley back one thing. And if you don't have to comment on this,
Yeah.
Kathy, but a very dear friend of mine, I want to just pay homage to him. His name's Ed Kim. He's an oncologist, and he's more than just that. He's a great human being. But he said we need to stop looking at a person as a cancer patient. We need to see them as an individual that just happens to have cancer.
Mm.
And so when we see people by the disease or whatever symptoms they have, um, we don't take the time to see them and know them. And so I think it's also the language that we use that can get providers, caregivers, even administrators as they see the world of healthcare. Because you said differently by even the way we approach and talk about it. Because as you said at the beginning, Glenn, this is a very human-centric business. It's very emotional. And my mom, I'm Cuban. Obviously my mother was born in Cuba. And for someone to look at her for just 1 minute is all it takes for her to know that someone makes her feel like she matters. So I just wanted to throw that out because as we're talking about this, tech is such a huge part of where things are headed. But what in the end is that really helping our providers solve for? What do you think it is?
Yeah, and it's great. It's a great thought to like, I would say sit on a little bit and see how uncomfortable it makes you feel because it is an uncomfortable space when you start to think about some of the products you hear come on market, right?
Yeah.
You hear people say, "Oh, you won't need a doctor. This can do what the doc." Like those sentences have a huge like I don't know, they rub me the wrong way for some reason. And I am a tech person. I live on technology, okay? Because I think it starts to become about tech and it's not about what are we trying to solve? What are we doing here? Because tech should be, people that jump to solution versus like focusing in on like what are we trying to get done? It it's just one of those things where I'm like, if you can stay focused on what this is meant to do, right? And the fallacy is the doctor is just meant to tell me the disease I have, how to fix it. Yeah, if I thought like that, I could see all the ways tech just comes in and slices that out over time, right?
Mhm.
And in time. Well, what you just said, looking at your mom for 1 minute, that eye contact, that sense that there's another person sitting in this room that's going to be on this journey with me, that feeling of I am just not another number of a person with this disease, but I'm X person with X identity, and this is going to be about my care, not just everybody's care.
Mhm.
So hard to just do with technology. But here's where I see tech playing the role, right? What is the data that's relevant for that person sitting in front? How do we give the
Mhm.
doctor more power in the conversation? How do we give them more of that humanity in the conversation or time for the humanity in the conversation, right? And
Mhm.
technology plays that role for me. And data is king. Like I would say every industry, healthcare, financial services, e-commerce, anything you want to talk about, data is the treasure, right?
Yeah.
And for the companies that win at this, they're going to really look at their data and they're going to say, forget everybody else's data, because everyone's going to talk about how everybody else's data is so important. And I probably will challenge that a little bit for healthcare because the institution's data shows their DNA a little bit, your outcomes, your doctor's advice. That's your differentiator a little bit, right? It's like
Mhm.
if you have better outcomes, it's somewhat because your providers might have done things slightly differently than, hospital X or healthcare system Y.
Mhm.
So that there's power in that for an institution. So for me, from a platform thinking perspective and technology's role, it's like instead of only thinking about the patient having, their phone or their device as a companion, how are we building for the physician to have a similar companion? So when the two humans meet, which they do need to, the
Mhm.
focus is on giving the provider the right tools, the right data to get deep on that individual. And really, to the point you said, treating people as this is still a person that is dealing with this disease, but this is not a cancer patient. This is not an Alzheimer's patient, a dementia, like this is a human. And there's a whole bunch of other data that we have on who makes up Kathy, right? Or who makes up Glenn. And so I see that role, it's almost like this parallel universe for the provider and how they can lean into that while still embracing the power that they have, because there's no tool I could give them that will form that type of connection you just talked about, or solve that piece of the equation where your mom walks out saying, no, 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 I really felt seen, or I really felt heard in that discussion. The technology is always going to feel a little bit more transactional in nature.
Um, I love what you said. So with that in mind, let's now move to this workforce in healthcare that is burnt out. What innovative approaches do you think can start alleviating this burnout that we're experiencing at an all-time high in healthcare today, Kathy? But what's been some of your
You know,
challenges and what opportunities do you see on the horizon?
Burnout's such an interesting topic because you see it at all facets, right? You see it at the frontline worker all the way through to administrative, all the roles, right? Because healthcare has such a high demand all the time. And I think it's gonna take a couple fronts, not just technology. I think there's going to need to be a shift in how we lead in this era. As leaders, leading organizations in healthcare, we're going to have to adapt a bit to some of the thinking from outside of industry here to say, how do we evolve as leaders that know how to deal with and adopt other ways that the workforce can work, right? And the reason I call that out is because, healthcare has a bit of fine lines, and the lines almost get created because of, call it what it is, how the payer world works and how things must be set up to get reimbursed or to meet regulatory requirements, right? But it's not designed because this is the right experience necessarily.
Mhm.
And because of that, the burnout is now ingrained because everybody is trying to operate with more demand with those infrastructural pieces that they must abide by. And that rigor and that build it's been in the DNA of these organizations for years and years and years now. And what it's going to take a little bit is that, how you talked about transformation digitally, cultural transformation is also a big deal when we talk about digital transformation, right?
Mhm.
So you're going to have to think about how the leaders are shifting their mindset about the work styles and how people work and what those hours look like and where they get that work done, right? How they get that work done. A little bit of shifting has to happen from just the current way it's done. And then there's technology. You're hearing a lot about, I'll give you a story. I was having my daughter and I had her at Hoag, and there was a nurse that I had, and she had, I don't know, 30 plus years of experience in labor and delivery, but she was going to retire.
Mm.
And she and I were chatting, and she was, keeping me a little bit preoccupied with, not thinking about all the other stuff that's about to happen. And she was saying, I wish, she's like, yeah, I'm about to retire, but I could still keep doing stuff, you know? It's just that, yeah, I need a break from being physically here and doing the labor and delivery part, but I have all this education about it. I have all this knowledge about it. I've
Mm.
delivered thousands of babies at this point. And I thought about that, right? And I'm like, how could you democratize that education? How could you leverage that as part of a gap in,
Mm.
you think about the traditional workforce of what the institution has, right? And she and I was just got on a conversation. She's like, yeah, if I could work like just a couple hours a day and it was on a virtual platform, I could answer questions the moms had, I would totally do that, even if I was, because in her head, she wasn't retired. She was retiring from the version of the role that she had today.
Mm.
And she was looking for ways to still use her brain and still be contributing and still potentially making some level of income in a very different way. But the way healthcare is set up today, that wasn't really an option, right? And so I call that out because that's where technology can help. That's where the platforms, the virtual nursing things you're hearing, I do see those as value add and ways we can reshift that. But rather than just seeing them as additions between the normalcy of, some of, oh, this, if it's at the hospital, it must be this way. But if it's like this other company, then it's okay. I would love to see that shift where even at the hospital, we can consider the different versions of that story, right? Because now you have this 30 plus year experienced person that could still be adding value, helping with the burnout of
Yeah.
the one nurse that answers the phone and runs in to check on mom who's in labor, right? Like you start to rethink, how does the flow need to look? What could we do? And can technology help with that?
Okay, I'm going to share a quick one. And I loved what you said. And I'm going to go back to the word ingrained, right? You use that. It's ingrained with how we've done things a certain way for so long. It's
Yeah.
ingrained to think about the payer, the coding, the infrastructure, the hierarchy. It's ingrained.
Yep.
So I was on a call recently with again, this is not about titles, but to put things in context, with the chief strategy officer of a healthcare organization. And the discussion was about, how do you lead leaders to uh, be more personalized in how they work with their staff and employees, let alone their patients. And he came out of the gate pretty aggressive and said, "All right, Glenn, answer this question for me. How do you personalize the way we work in an industry that is highly regulated?" I said, "Do you want to add anything more to that question?" He goes, "Nope, that's it." I said, "Okay, here it comes. Where's the regulation for how we treat people?" And he stopped and just like looked at me and said, "Now I know why you asked me for a follow-up, because you knew that the question that I was asking you was the wrong question." I said, "It's not your fault. But when you're so ingrained in thinking about an industry a certain way because it's always been done that way." And I guess this is the point that you're making about uh, this uh, this nurse who's
Mhm.
been there for so long and realizes herself, I need to reinvent how I use what I know. Because, like you said, I want to retire I, away from this current version of who I am and use my skills and capacities because they still have value.
Yeah.
But you just answered the question, Kathy. Forgive me. Most people feel that way.
Yeah.
They don't like that current version, but deep down inside, they know that they can offer value. But because no one's ready for that different type, they get burned out by doing it the way they've always done it. So I think there was a nice little unlock you shared, or you revealed with that story, because it is so important to push here and say, ingrained to do what at a time when that ingrained way of thinking doesn't matter anymore. We've just, because it's mattered for so long, we make the assumption that it still matters because we don't know what else, or we don't know how to use the real value that we bring, and therefore we get burned out. I don't know. I'm just throwing that back at you.
No, it's so true. When I started in at Hoag, I remember coming in and I was like, oh man, this is a complex industry. And I started to learn. And I was the new girl, and everybody, I would ask questions, which is just my nature. And I'd ask questions, not because I'm trying to say anyone's doing anything wrong. I'm just naturally a curious person. And so I'd be like, why? Why do we do something XYZ? And someone would give me, I could tell those were the textbook answers. It's Stark law. It's this thing. It's that thing. And I'm like, oh, what does it say? What does the law say? Like, what are the words? And they look at me and you'd be like, something around that whole concept. I'm like, oh, okay. I put a little note in my notebook, and it's so funny because I was having one of my like, I go through these. I tell everyone towards the end of every year, I'll have my reflection. I'm like, did I add value into the world this year? Let me go look in this notebook. And I went back in my notebook, seemingly so end of last year, but I went all the way back. So look at the little
Mm.
notes I made. And funnily, I can now answer these questions for myself. And what I learned is for some people, when they started in their role, someone said that exact same sentence to them. It's this law. And the question ended there. There was no other question. And so they went on. They said, that's not possible. There's a law, right? No one pressure test. Well, does this law apply to this thing? Or are we just like, what is the law? Right. So I went and I found someone that really, I remember what I did that time. I went and found someone that really knew healthcare law. I was like, all right, I'm going to go look for someone that knows healthcare law. And I didn't even look internally to start. I went externally. I went in my network. I reached out for help and I sat down with someone and they educated me and we went through some things. And I was like, wow. Number one, I came away so many things that were written so long ago that it makes absolutely no sense in today's world. Like just from how people do things now, it doesn't even pertain anymore, right? And the second thing in that, I realized no one's asking questions. So they just get onboarded with these blanket statements. It's this regulation, it's this law. And if you're not doing the homework or you're not pressuring for an answer that goes deeper than just, why can't I do it? You know, you then end up just like everybody else. You get ingrained. And then you become the person that says, well, it's that law. To this day, I don't think I've used any regulation as a reason we can't do something. I don't start there ever. I'm like, okay, well, let's pick it apart. What are the word choices? Because every word choice means something, right? And I'm not asking everybody to like now get at me because they're like, you're completely wrong about the law. I'm not saying that. It applies in some many, many, many ways. But we've just gotten into this habit of just moving and not looking left or right and just kind of straight ahead. And I feel like it's such a challenge for healthcare in general, because I see a lot of people do that every single day.
So the big takeaway here is we must begin to start unlearning things that don't matter anymore.
Yeah, absolutely.
Unlearning. I mean, people keep talking about, oh, we got to learn more about how do we remain relevant and get out in front. No, equally, you must start unlearning. I think that's the big takeaway here.
Yeah.
So let's shift now to healthcare marketing. I mean, we know that we are now in the business of serving a patient who is a customer, but we're also in the business of marketing to an employee who is a customer too. So I'll just throw out a roundabout number. In the last 7 years, we've gone from order takers to consumerism, radically shifting the business model, radically shifting how we get paid, and yet we still have a lot of unlearning to do. So you really did a nice bridge here to this topic because now that we're in the business of satisfying and or selling a consumer, how we market to them is radically different than the ways we've marketed to healthcare to people in the past. So if you wouldn't mind, if you could just step back from what you've observed and learned, take us to this evolution of healthcare marketing. Where was it and where is it going now with this more humanistic touch?
It's a great point. And the reason I actually, it's the right time to ask me this question is I took on the marketing organization beginning of last year and leading it. And, it was a tough time because I took it on and I realized right away that it wasn't really marketing. Most
Mm.
healthcare, it's not marketing. It is communications. It is get something out. This is the most important message we have to tell everybody, right? And from this is where it's so funny when people ask me about the tech side. What did you bring from Amex into healthcare? I said, I brought some stuff, but some of it I had to unlearn myself because in order for me to figure out how to solve it, I needed to disassociate with some of the things I thought to be
Mm,
true from a technology perspective, because healthcare really did that to me, right? Um, Marketing, however, I spent a decent amount of my years at Amex leading and driving growth marketing. And some even worked in some of the brand stuff that we've done from the B2B side. Uh, so coming into this and taking on the marketing org, very quickly, I'm like, this is really just getting things out, communication. This is not really marketing. And why did I say that? One, there was no data that we were operating from. There was no business intelligence, strategic market share insight that I was working with to then say, what's the marketing strategy or plan next, right?
mhm,
There was no customer sentiment in terms of what would drive someone to want to interact with us if they were to see an ad or if they were to read a story in a magazine about Hoag. Like, what are those touch things that would be from a healthcare industry perspective compelling? And I had to make a tough call and I had to redesign the entire team.
mm,
And that's always hard to do. And last year was rough because I'm trying to rebuild this ship, but I have the organization that was used to marketing saying, I want more out. I want to send this out and send that out. And I'm like, do we know if any of it is working? Right. And that was foreign for everybody. They're like, what do you mean? Right. I'm like, what do I mean? I mean, do we know if this is driving us, to your point, in consumer consideration? That's a very different terminology from a healthcare perspective, right? Because most people, I'm sick, I show up at the hospital. Well, if you want to actually achieve that word in the health part of that word, health industry, healthcare organization, if you really want to go at health, you can't just go after the people that only show up here when they're sick because you're not achieving health. You're achieving fix me up, right?
mm.
And so, unless we want to become like the fix me up industry, we have to think about marketing very differently. We have to go after how does the consumer think about us? We got to get comfortable knowing that they think about you only when something's broken. That is true. They don't get up, they don't say, like, today the iPhone X would drop. You're excited. You're like, oh my God, can't wait to get on and buy that iPhone. No one gets up and is like, oh, can't wait to visit the emergency department today. Nobody's saying that. So you got to be okay with that and know that's the product that you're trying to get people to think about. That's step one. Step two, you're also trying to get them to think about you when they're not sick, because many of the healthcare organizations are trying to push there, right? They're like, we want to be your source for anything health related. It's a really hard leap and it's a really hard challenge when you as an org don't understand that's not how the consumer thinks about you to begin with.
Mhm.
So, what I've been doing with the team, and so we redesigned that team. I brought in a new CMO. He's working on building out that team. And what we've been really shifting to the marketing strategy is really thinking about what is our brand strength? What does the consumer think? What are they looking for from healthcare as a narrative, right? Forget if whether you're a hospital institution or you're not, or you're an app, or you're a startup, venture backed, whatever. What are they looking for? And what are our strengths, weak spots? And now build the strategy of what the messaging and the communication needs to be, right? And we've been putting out some wildly different stories. And what we've realized is our product is what the physicians do for the human. Those patient stories, what comes out of those outcomes, which is any product, right? Your iPhone, shot with an iPhone. It goes to the core of what is best about this product. And so we've been really focusing in on that and bringing those stories to life in a very different way than just, generic messaging, generic doctor pictures, generic patients being happy pictures. And I think number one, we're dealing with some of that, obviously cultural change that needs to happen, but we're seeing the results of doing the work that way already. And it hasn't even been that long. It's probably been a solid 6 months of doing it that way.
I have to ask this question. You've said it twice now, so now I'm going to jump in. earlier with the first question than now. The provider is our product. Do they see themselves as that product, and what role do they play in this shift from communications to marketing? Because you've just elevated the value of that individual in many respects.
Yeah. I would say they always might have thought of themselves as an important part of the narrative for sure, but I don't know
Yeah.
if anyone's kind of commercialized a term into that way for them, right?
Mhm.
That said, I think even what we've been doing with the providers, we've been working directly with them. So
Hmm.
we start from the onset in thinking through not only what message, many times a provider will come on and say, what do you want to say? No. We said, we ask the questions that we know from a consumer. That's what they want to know. Like, hey, you want to know when you're dealing with a situation, you're thinking about your mom had a stroke, things like that. You don't start the conversation by like, let me see which healthcare place has the best ad. No. You know, you do what any consumer would do when they're looking for the best product, right? Who has what do you start with? Do you start with which facility has that latest machine? No.
No.
Which facility has like, the best inpatient room? No. You start with what? Who has the best doctor to give my mom another 50 years because this
Yeah.
thing just happened to her? So if you go back to product principles, right? Then that's the product. That is what is most valuable to the patient. They wouldn't show up here if you had no providers. Doesn't matter what you have. You could have the fanciest hallways, you could have the best equipment. If there isn't the top skilled doctor to use that thing, they're not coming. And so we've really grounded both how we think about our digital strategy, and it's how I'm pushing the marketing department to think about what we do here from a marketing perspective in healthcare. Now, you asked the question broadly. You said, hey, is this where healthcare is going? I don't know if everyone agrees with my perspective there, but it is one that we've been doing it for 6 months now in that light, and we're seeing a very positive ramp in what that's doing from consumer sentiment in terms of I didn't even know you guys had that. I didn't even know you had that expertise. I didn't knows that I'm hearing means that the marketing is actually working.
So, because of time, I want to get into a couple more big topics. So, thank you for going deep and wide on this one because I think healthcare marketing, as much as we've been at this consumerism thing for a few years now. I still feel like for many, we're still at phase one,
Mm-hmm.
and we're not just trying something new for the sake of doing it. That's why you're here. I mean, you are someone that isn't about just putting something else out there. You're there to examine and understand why we're even spending the money to do it, not just from a financial standpoint, but from an effectiveness standpoint, because I mean, you're in a area there in South Orange County that's quite, competitive,
Mm-hmm.
so there's a lot of reasons behind it. So thank you for sharing that. Digital. I mean, we've heard this term digital transformation now for a while. Um, at what stage do you see digital transformation at right now amongst healthcare systems? And are they really as prepared? Are these transformations really where we want them to be right now?
Yes and no. I think I told you this. You and I don't remember if it was a podcast or what. And I said the title and I'm so glad you started with titles really don't matter, and they don't. Um, and they don't because title doesn't automatically means you know everything or you alone are responsible for that thing. And sometimes
Hmm.
titles do that for people and in organizations. And when you bring someone in and they have this title, suddenly the organization thinks it's that guy's job, right? It's Johnny's job over there. But the missing part in transformation for the organization is it's everybody's job. And so you almost need to rethink when you are being very serious about embracing transformation in an organization. It could be any, I give this advice to any industry. You have to decide on how you're going to change everyone's role to embrace that narrative. Even if you put someone optically in there to help drive the change and spearhead the initiatives and
Mm.
be accountable there, you have to then say your entire executive team owns 100% accountability in making sure it happens, right? That to me has been the biggest Achilles heel in healthcare because many times they've adopted roles like mine. And I don't know, and I talk to others that are in roles like mine too. So it's not just a one, perspective here. I don't know if everyone really understood the hard work it would take across all the other roles in the organization to get to where they need to. So yeah, you'll see, every day you went to Becker's, you went to Hims, you went to Vive, and everybody was like, we're transforming because we brought a bunch of tech in here. I'm not one of those people that will say that's what success and transformation looks like. When you have every role in that organization, let's say you were doing digital transformation, success for me will look like when everyone is able to go up and present the strategy in the exact same way. But if
Mm.
I'm the only one talking about it the way you and I are talking about it, we've made progress for sure. I've done some amazing things right now. I wouldn't undo what I've done ever. I would do it in a heartbeat again. But I also, you'll never get the answer that I will say to you that I have figured it all out. I have not. And the reason has been what I have figured out is what I'm missing. And I think that'll be true for anybody I look at in healthcare. And that people always ask me, oh, Mayo must have it all figured out. This one, like no one has it all figured out. And I could tell you because I've seen technology and I see all the buzzwords being used and I know exactly what that pertains. Until everyone can go to that conference and speak the same way about what either digital means for their organization, how it's used by provider and or patient, we haven't achieved that result or that goal yet. So that's where I stand on that particular topic, which is probably
Well,
not the popular opinion.
well, in an interesting way, Kathy, you spoke about a topic. You actually spoke about leadership because you basically said if we're not all leading this strategy, we're practicing substitution, not evolution. That's what I get out of this. And so it goes back to leadership. It goes back to are we are, do we have to move out of what we've been indoctrinated and ingrained to do to now adopt and take on accountability measures that need to make us feel uncomfortable if we're going to get to where we want to go. That's what I got out of that.
Absolutely. If you're
So,
not uncomfortable, you're not learning anything, by the way, right?
anything. So with that, let's finish with what is your vision for the future? What do you see 10 years from now? Like what do you see? Because it's clear that I see you managing a very large um, ecosystem with many parts, all interconnected, some perhaps disjointed. And you're creating this mosaic, this puzzle of all these different systems and people and opportunities. What does that look like? What is the outcome of that uh, in the future? What do you see it looking like in healthcare?
It's so crazy to me because it feels, you and I were talking pre this recording about, some of the being real with yourself. And 2 years ago, if we were talking and you said, what do you think the future? I had some answers. I really did. I really had some thought and answers. And I will say in the last year, the future looks, I'm not going to talk about tech because tech will go through what I will say is a big beat up. Who survives it in terms of tech companies and how consolidation happens, what that means for all of the substitutes, all of the plugins, all of the EHR monopolies. I see all that stuff getting disrupted. I see it all getting disrupted, and I don't know the exact answer there. But what I do think is going to be just as important as the landscape. So what I'm doing now is building mosaics. And the reason I'm doing it that way is because I want to stay flexible And I think that's
Mhm.
a word everyone better embrace fast. How are you not coming in and saying, if someone gets up and they said, this is a tool we're going to use for next 20 years, I'm like, no, we're not. No, we're not. Don't say that because that is the pace at which things are going to come at us is going to be pretty we're going to be pretty unprepared for, right? And even me saying it, I'm not prepared for it. I can say it, but I'm not prepared for it because it just feels so uncomfortable, even as a human being. And I will say I'm one of those humans that could sit in a lot of uncomfortable zones and I can take a risk and I'm okay with these things. I feel like the future is going to be even more so uncomfortable because everything we know foundationally is going to be challenged. So your statement about unlearning, part of the future is going to be all those unlearnings to figure out what is the right role that you now play. And I'm not trying to fear monger here. It's not about that,
No, 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 no.
but it's
It's
about, okay,
reality.
it's a reality to just get in your head, even if it's weird to think about it. So from a tech perspective, the reason that Mosaic is important is because I want to stay flexible and I want to be able to pivot and I want to figure out how fast could we get to. Forget about agile development, forget all those things. How fast can we actually get to being flexible, nimble, experimenting, not being stuck on anything? Forget about 2, 3, 5 year contracts. Remove all those things. Okay. And so that in the future, you will see that. You will see some monopolies play up. You will see a lot of consolidation. And I think healthcare is definitely probably going to feel a lot more transformed than it is today because of the rate at which technology is now going to supercharge and or um, impact it, right? And before it used to be, hey, well, everything starts with what the EHR can let us do, but I don't see that being the same place we're in 10, 15 years from now.
I'll wrap it up like this. I'll ask you for the final word here, Kathy. But you so you articulate things so well. And what I got out of what you said is, look, Len, here's the deal. We are in the process of reinventing the foundations upon which will determine what the future will be.
Absolutely.
That's what I got out of that.
Yeah.
And it's fascinating because you started by saying, oh yeah, with a quick example, I think of, well, that'll last us 20 years. And you're thinking, that's so standardized. That's the way
Yeah.
it's always been thought. And we're just trying to reinvent the foundation that will, if we get it right,
Yeah.
take us to a positive trajectory into the future. And I share this reaction because I'm concerned that we won't redefine the foundations properly as an industry. I'm sure you're going to nail it. And that's why I always enjoy having you have share your thoughts because they're so real, they're uh, realistic while humanistic with optimism, but yet with your feet on the ground and your hands in the soil. I mean,
Yeah.
you realize that this is a heavy lift, um, and you're excited about what can be. But I think it's just another part, the reason and it's great that that term mosaic clicked with you
Yeah.
because because if we don't see it that way, we'll just get stuck all over again. And then the patient's in trouble. And this
Yeah.
is what I think really concerns me is that people think we have time. We don't have much.
Hmm.
And I'm not trying to be a downer because I'm here to actually lift up and get people like you with great thoughts and people who have actually done the work, paint a positive picture of what's to come. But this is going to take a lot of hard work.
Yep.
Um, and I want people to realize as they're listening to you, know that you've really given them a realistic blueprint of what they need to stop and look at for themselves, for their organization, their teams, their leaders, and ask, are they willing to put the work in? Because look, I've known you for a year now. You've worked hard hard. You don't even have to tell me. I know. So I thank you so much again for another enlightening discussion. Any final comment?
No, as always, it's always a great discussion, and you make me like think about things that they're there, but I'm not, present in them all the time. And, I think success is something that everybody's always asking for or looking for. Like, is this successful? Is this making it? Is this the thing? And you said it well. It's like we are in an era where we have to rethink how we ask the questions, how we answer them, how we approach problem solving almost, right? And if when you're met with a decision to do a new platform, do a new trend, you see an article in Becker's or anything, and you're like, oh, we should do that. No, go back to basics. Some of those basics are going to be your clutch, right? What is the problem? Does it solve a problem? And thirdly, are we approaching how to solve that problem with all the right pieces before we just jump to what everybody's talking about? I've always been that at the core, but I think it's even more important now because it's so easy to get swept up in the tidal wave that's happening around tech and healthcare, especially so with everything happening on the AI front going on. And yeah, like I think speed is going to be our enemy. Like, how fast can we all unlearn, get into that zone, and be strategically leadership groups, being strategically aligned and one, and not all just kind of thinking about their own pieces of the wheel. That's hefty, a hefty mission in of itself, right? But always a great time chatting with you, Glenn. And I'm hopeful this was helpful to your audience and who listens to the
Absolutely.
podcast.
Absolutely it is. And I'll play off what you said just to kind of finish the thought. We must learn, unlearn, relearn, repeat. Learn, unlearn, relearn, repeat. This
Beautifully said.
is this is the cycle of reinvention.
Yep.
And unfortunately, we love learning, but we don't like unlearning.
No.
And then relearning gets even tougher. And to repeat, good luck.
Yeah.
But this is I wanted to bring that into the fold because I hope that you realize that you have this natural ability to do all four.
Yeah.
So, Kathy, thank you very much. And as we end every show, when you lead in the age of personalization, you will see things that others don't. Do what others won't, and keep pushing when prudence says quit. Always a pleasure, Kathy. Thank you so much.
Thank you, Glenn.
Thanks for listening to Personalization Outbreak. Make sure to subscribe so you never miss a show. If you enjoyed the content, visit ageofpersonalization.com to check out our free streaming video series and learn how to get involved in the movement. I'm Glenn Llopis. I wish you a good day, and remember, without strategy, change is merely substitution, not evolution.